And the Aylward family is here to illustrate the magnitude of what we've lost. They've created together a display which many of you have helped us set up. This is a display of handmade roses, one for every person who has died in COVID in our province. In the first year of the project, the roses were all color-coded to illustrate the death toll and how it fell heaviest on our seniors. But ever since the Kenney government's essentially declared the pandemic over last summer, Erin Aylward and her children have been making black roses to represent the deaths that could have and should have been avoided. Kamrynn, please come up and tell us about what you guys have created together.
So I think we are here today to shine a light on a simple truth. COVID is no joke. How many people have died? 4,300 in Alberta since the start of COVID. Oh, well, yeah. These flowers are devotion to my mom, my sisters, and I, handmade for each of these needless deaths. The black flowers, the saddest of all, symbolize Kenney's best summer ever. Maybe I don't get best summer. I don't understand. As a teen, it's my job to become more mature. While getting ready to speak to you today, I googled maturity. One of those things was describing some scientist who gave kids the option of a cookie now or 2 cookies later. It was a part of how they measured emotional growth, how developed the kids were. That makes sense, right? Yet every day I hear how the government treats COVID like an obstacle to their money and re-election. COVID is something that they are in a rush to get through. They want the cookie now, whether or not we get deadlier and more COVID cases later. To these adults, I plead with you, wait, don't rush. Wear masks and get your vaccines. And please, please don't lift mandates. Listen, I get it. Going through 2 years of COVID as a kid has been way harder than I expected. It wasn't easy doing online school. The delay in chats made it hard to complete ideas or be inspired, though it was fun laughing at the adults struggling with technology. Wait. But that has been the end of the laughs. It hasn't been very fun at all. It's been very lonely growing up during COVID. You can't do very much, especially with the need to be vaccinated to go anywhere. Me and my friends often complain over voice chat and try to provide each other with as much comfort as we know how. And then every time we think it's safe or we can't take it anymore, politicians everywhere rush to lift the restrictions. But then, like the perfect anime monster, COVID mutates. We need to sacrifice comfort to avoid the sacrifice of lives. I need to know my grandparents a little longer. I love them, and I can't picture a world where I had to make a black flower to help some people understand the terrible math, though we are hopefully living. Hard decisions are hard, but every time mandates are lifted, we get more deaths 14 days later. So again, please, 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 do the mature thing. Keep the mandates. Wear your masks, if not for yourself, then for your family and friends. And also, thank you to our teachers who have worked so hard. They deserve our love and support, but instead are about to be in even more danger with the lifting of COVID protections in our schools.
My name is McGowan. I'm president of the Alberta Federation of Labour, and I'd like to welcome you today on behalf of the groups who have organized this event: the Alberta Federation of Labour, the Friends of Medicare, Public Interest Alberta, the Parkland Institute, along with a number of other groups and individuals involved in what we call the Alberta Civil Society Action Committee. We are gathered here today to mark the second anniversary of the World Health Organization's declaration of a global pandemic. On March 11th, 2020, the WHO's Director General announced that our world was facing a public health crisis, the likes of which we had not seen since the global flu pandemic of 1918. Since that time, since the time of that press conference on May 11th, 2020, billions of people around the world have been infected by the virus. More than 6 million people have died, and millions more are suffering from things like post-COVID disabilities. Here in Alberta, the second anniversary has been made more poignant because it corresponds with another grim milestone. Just yesterday, we passed 4,000 COVID deaths in this province. More than half of those people died after our Premier declared that our province was open for summer last June. This bitter anniversary also comes at the same time that governments around the world, around our country, and right here in Alberta have been eliminating the very COVID protections and measures that have protected our citizens, and at the same time that many of those very same leaders have been dismissing experts and ridiculing citizens who say that these steps are premature and reckless. So we are here today to do three things, and I call them the 3 R's. First, we are here to remember. We are here to remember all the colleagues, neighbors, friends, and family members who we've lost, who have suffered severe illness, and who have been disabled as a result of this terrible virus. We're here to remember all the healthcare workers, first responders, and other front-line workers who have faced and who continue to face higher risks than others in their daily work environments, and who have paid with their health and sometimes with their lives. And perhaps most importantly, we are here today to remember the failures of our provincial government. How they failed to follow the science, how they failed to set aside ideology, how they failed to put the public interest ahead of the narrow political interests of themselves as politicians, and how Albertans have paid dearly for those failures. Second, we are here to remind. We are here to remind ourselves and others that despite the spin and rhetoric coming from certain politicians and pundits, this pandemic is not over. We're here to remind ourselves and others that COVID is not mild and it is not the flu. We're here to remind ourselves and others that the virus doesn't care if we're tired. And we're here to remind ourselves that the effectiveness of vaccines wanes, and that having COVID once doesn't mean that you won't get it again. And we're here to remind ourselves that the virus is still filling our hospitals, that it is still mutating, and that it is still changing, and that it is not a guarantee that it is getting more mild. Finally, we're here to show our resolve. It's understandable why so many people have been quick to embrace the move away from COVID rules and protections. It's been a long 2 years. People are tired and they want to believe that it's over, but we know that it's not. So we must resolve to continue speaking out. We must resolve to continue following the science. And perhaps most importantly, we must resolve to make the case that learning to live with it should not mean doing nothing. And that means that we must resolve to continue supporting mask and vaccine mandates when they're necessary. We must resolve to continue pushing for our governments to support testing, tracing, and isolation. We must resolve to continue to demand rules for better ventilation and air filtration in our indoor environments. And we also must need to resolve to continue pushing for paid sick days so that people can afford to stay home when they need to. In the end, why I'm here today and why you're here today is because our leaders have failed us. Our leaders are letting us down, and that means that we collectively have to step up. And we'll do that by acting on the 3 R's: remembering, reminding, and being resolved. Our next speaker, she almost needs no introduction, but here to talk about the pandemic from the perspective of healthcare workers. Please join me in welcoming Heather Smith, the President of the United Nurses of Alberta.
Thank you, Gil. To acknowledge that we are here on Treaty 6 territory of Turtle Island, and thank the First Peoples of this land for hosting us today. I am here today to represent healthcare workers, not just the 30,000 nurses represented by United Nurses of Alberta. From physicians to housekeepers, all of the professionals and staff who provide direct care, and of course those who support the work of the care providers. I cannot convey the anguish and trauma they have experienced, continue to experience, as they attempted and continue to attempt to support individuals and families confronted with the reality of COVID-19. They are witnesses to the suffering and loss. They had their own fear and experiences when they too have succumbed to COVID. The physical and psychological injury is real, and it will be long-lasting, just as it will be for the unknown number of victims who will suffer long COVID. 1 year ago, we gathered, not here, just up there, to acknowledge the first anniversary of something never imagined in our lifetime, a global pandemic. While we in Alberta were aware of outbreaks such as SARS and Ebola, it was news. It was a news story, not our reality. But COVID-19 became everyone's reality. It has exposed the weaknesses and deficits in our healthcare system and in the supports we do and that we do not provide to the most vulnerable in our society. Many have experienced the collateral damage. Those who have experienced long delays in emergency departments or waited for an EMS team to arrive, appointments or treatments delayed or cancelled, and the thousands of healthcare workers that have been redeployed or reassigned across the continuum. Some Albertans have lashed out at the very workers trying to help them or their loved ones. Some Albertans have denied that COVID is real and refute the science of protections, including vaccines and masking. But 4,003 deaths attest to the reality and danger that surrounds us. 1 year ago, we acknowledged the loss of 1,933 Albertans. 1 year ago, we had 4,488 active cases. Today, as we recognize the loss of 4,003 lives, we actually have 6,600 known active cases. We know we have a lot of advocacy and work to do to repair and rebuild in acute care, in long-term care, and home care, right across the continuum. But the damage and havoc of the invisible airborne terror is not over. We still have over 1,000 Albertans in hospital. It is not yet time to throw aside precautions and protections. I wish we had used the term precautions or protections instead of restrictions from the beginning. Vaccinations have mitigated the destruction, as masks have disrupted the transmission of this lethal virus in our workplaces and in our communities. Like hand washing and physical distancing, these have been precautions, protections. If asked what I would hope for today, I would say two things. It is imperative that we learn what we in Alberta and Canada have experienced, learn from what we in Alberta and Canada have experienced, and our rebuilding must be evidence-informed, particularly as it relates to the use of our public healthcare dollars. In the days ahead, days, weeks, perhaps months ahead, I would also ask for respect and tolerance. Masks will continue to be a required precaution in healthcare settings for our safety and for yours. And for some, it will continue to be a necessity. But it is now a personal choice as we go about our daily lives, whether that is going to a grocery store, shopping, or a social event. And that choice must be respected. I'm going to do something now. I'm going to have 1 minute of silence, please. That was 1 minute. If we attribute 1 second to each life lost, that would symbolize 60 lives. To acknowledge the 4,003 lives we have lost, we would need to stand here in silence for 1 hour and 6 minutes. For the 4,003 stories cut short, may the suffering and anguish of those departed and those left behind not be in vain. Thank you, Megwich, for joining us today.
Thank you very much, Heather. Since the beginning of the pandemic, the weight of the death toll has felt disproportionately on our senior population. So to talk a little bit about the lives lost and the lives changed, especially in the seniors community, we are joined this afternoon by Judy Lederer from the Public Interest Alberta Seniors Task Force. Judy?
Thank you. Can you hear me? Okay. I'm here on behalf of the Public Interest Alberta Seniors Task Force. We've heard how many people have died so far in this pandemic. 4,003. But of those 4,003, 90% were in an age group 60 years and over. 3,585 people aged 60 and older died. And as we witness these beautiful flowers laid out here, the white, silver, and gold, signifying the deaths of these people, it's a stark reminder to us all that our senior population has borne the brunt of this pandemic. And nowhere was it shown more clearly than in our long-term care facilities, where Canada led the world in per capita deaths. In June of 2020, in the beginning of the pandemic and before the COVID vaccine rollout, 81% of all COVID deaths took place in these facilities, almost double the average of 42% for the other OECD countries. These seniors who built our country and our healthcare system paid the ultimate price, leaving behind grieving families, friends, and community. Many died alone, unable to be with their loved ones before they passed, or they died with caregivers, serving as the last human contact before their deaths. They died because our continuing care system failed them. This tragic outcome hurt everyone. The seniors who lost their lives, the families who lost their loved ones, and the caregivers who did their best under the worst of circumstances, overworked, understaffed, and underpaid. Our continuing care system exposed the many cracks formed over decades of privatization and cost-cutting. During this pandemic, many long-standing issues have come to light. Insufficient numbers of qualified staff, overcrowding in rooms, poorly paid staff, lack of proper staff to resident ratios, lack of proper testing, lack of appropriate PPE, aging facilities, poor ventilation systems, neglect, isolation, the list goes on and on. Our seniors deserve better. But clearly, long-term care has become a multi-billion-dollar industry of real estate, commodifying and exploiting our senior population for profit. To illustrate, in 2020, long-term care operators Extendicare and Sienna paid a combined total of $74 million in dividends to their shareholders, while more than 480 staff and residents died at their care homes in Ontario. All seniors should be able to count on our health and continuing care systems to receive the level of care we need regardless of our ability to pay. With seniors projected to become 25% of our entire population by 2030, a mere 8 years away, we need to do more to prepare ourselves to better serve our senior community. The Public Interest Alberta Seniors Task Force believe that systemic change is long overdue. In our submission to the UCP government's facility-based continuing care review, we recommended the following: get profits out of seniors' care, create an easy-to-navigate system, ensure appropriate staff-to-patient ratios and mixes, provide quality care based on need, not ability to pay, and legislate an autonomous office of the seniors advocate. Despite our input, our current UCP government continues to ignore our advice and the findings of numerous seniors organizations, advocates, researchers, and the healthcare community who have been raising alarms about the deficiencies in facilities-based congregate care settings for more than 30 years. As Friends of Medicare commented on the recent 2022 UCP budget, the facility-based continuing care review will simply result in the government handing out public health dollars over to private for-profit providers while avoiding any transparency or accountability to Albertans. It is time for our federal government to step up and show leadership with legislation spelling out enforceable long-term care standards. The conditions of work are the conditions of care. Federal funding for health care and long-term care must be contingent upon the province's compliance with those standards and a commitment to seniors' care delivery based on the 5 basic principles underlying the Canada Health Act. Alberta seniors deserve better. We all deserve better. Let's work together to defend, protect, and expand our public health care system. Thank you for participating in today's event, and please visit the Friends of Medicare or Public Interest Alberta websites to sign a letter asking for an independent seniors advocate office. Thank you.
As Judy has reminded us that the weight of mortality has fell disproportionately on our seniors population, in a very similar sort of way, the economic tragedy that has unfolded as a result of this pandemic has fallen disproportionately on another group of Canadians, and that is the women among us. As economist Armin Yalnizyan has said, the recession that has followed as a result of this pandemic can arguably be described as a she-cession. So to talk about the disproportionate burden that has been carried by women in our community as a result of this pandemic, please join me in welcoming Merryn Edwards from the Women's for Rights and Empowerment. Merryn.
Thank you. Thank you to all the organizers of this event, the individuals in the organizations, and for the opportunity to speak. And the work that all advocacy organizations and people are putting forward, to put forward the solutions that are needed, not only to confront the pandemic, but also to realign our society to address all the deep-rooted problems that have been exposed so starkly during these last 2 years. Women for Rights and Empowerment is a grassroots organization of women who are active in our unions, communities, and other organizations who are fighting to defend the rights of women and defend the rights of all. Everywhere there are struggles to defend people's rights, we will see women in the forefront. And it's become urgently apparent that we need to build more of that kind of leadership. We've seen governments and corporations not only miserably fail to provide for people's well-being during this pandemic, but actively block the solutions that working people are calling for. Many of those solutions have centered on all types of caring work and how it's structured in our society, which right now I think we can all agree doesn't start from the fundamental question of how we can provide for human needs for care, childcare, healthcare, home care, seniors care, and everything in between. The vast majority of the people doing this work are women, and there's no doubt whatsoever in my mind that if those women working in seniors care, for example, had greater control over their working conditions, we would all be in vastly better hands than the companies running the show and the government's funneling money to them. There's so much to be said about women and care work and how the women doing the care work that of all kinds must be in the lead for reorganizing that work around actually meeting human needs. But there's just a couple of points I wanted to highlight for you here today. So first of all, I wanted to talk a bit about home care. I think we're seeing an ever-increasing push toward home care as a kind of solution or avoiding the confronting the problems of seniors care, especially given the wake of the spectacle of suffering coming out of congregate care. So in my day job, I work with CBI home health workers, and they are paid much less than seniors care workers doing much of the same kind of work. There's no income security whatsoever. They're working in private homes where they often see how poverty and housing issues are intimately connected with and impacting people's health. They're paid according to schemes of piecework, just like the garment workers who inspired International Working Women's Day, which just passed, and those workers who fought against their dirty, difficult, and dangerous working conditions. We cannot allow this type of home care to be presented as a viable solution to the crisis in seniors care. We have to take a firm stand as an entire society that all healthcare workers, at an absolute bare minimum, must be earning a living wage at one job, not 2 or 3 part-time casualized positions. The vast majority of women doing this kind of work are immigrants, and the pandemic has reminded us of how core migrant workers are in virtually every sector of our economy and society, including an estimated 500,000 undocumented workers who don't have access to healthcare themselves. These are people who have been brought here to work, but who have been tossed aside, falling out of status through no fault of their own, often due to processing delays during the pandemic. So I urge you to support campaigns like the Migrant Rights Network that's calling for regularization, or in other words, granting legal status to all migrant workers who are currently here in Canada. By doing so, we assert that the working people of Canada are one working class, and we will not allow ourselves to be divided along artificial lines such as immigration status. The second thing I want to emphasize and highlight is about childcare, another huge area of failure in Canadian society to adequately meet an obvious human need. Women in Canada have been fighting for childcare for more than 50 years. Again, the pandemic starkly exposed the connection between childcare and women's roles in the society and the economy. And childcare advocates and activists have been talking about that connection for many, many years. It's questionable very questionable, whether or not the new federal program will get us even back to the number of spaces that were lost during the pandemic, which was already woefully inadequate. And again, unless the women working in that sector have not just living wages, but all women and indeed all working people have a say in how childcare is developed and delivered, we can be sure that the standards set by governments and corporations and their interests will not be guided by the meeting of human needs. I salute all the women here today and all the women throughout Canada who are thinking and talking about why things are the way they are and working amongst ourselves to work out the questions of what must be done. I'm glad that the next speaker is going to be talking about education, because this is such an important area to focus on if we are to make sure that our young people have the tools and information to keep working out our own solutions to rise to the challenges of this pandemic in an uncertain and shifting world. In closing, I'll just say that we honor the dead when we fight for the living, and the Women United will never be defeated.
Never be defeated. The women united will never be defeated. The women united will never be defeated. Thanks very much, Merryn. When people think of the pandemic and its impact on our communities, their minds often first go to hospitals and healthcare facilities. They think about the patients, they think about the healthcare providers, but another institution that has been racked by this pandemic are our schools. And in fact, arguably our children who we send to these schools every day are among the least protected and have been since the beginning of the pandemic. So to address the impact that the pandemic has been having on our kids and our schools, and to talk about how those challenges still persist today, even as our governments pretend that the pandemic is coming to an end, we're joined today by Wing Lee, a spokesperson for SOS, Support Our Students.
Good afternoon. My name is Wing Lee. I am a director with Support Our Students Alberta. We are public education advocates comprised of not only parents, but also educators, students, and members of the community. Because education is the pillar of democracy, public education that is accessible to all children, regardless of background and being able to pay. And public education was ravaged by the policies of this government because they underplayed the impact of COVID on children, wave after wave after wave. We've been fighting for the right of every child to access equitable and barrier-free public education since 2015. In the past 2 years, COVID and inadequate public health protections have been a barrier for many Albertan children to access quality education. As a volunteer organization, we advocated for policymakers to take the impact of COVID on children seriously. We also tracked school cases through crowdsourcing, because the government consistently obscured the reality of outbreaks and spread in schools. The fact is that in 2020, when the pandemic was declared, we knew public schools in Alberta were not equipped to mitigate this spread because of years of chronic underfunding of public education. We face billions of dollars in deferred school maintenance, and class sizes have been ballooning since the early 2000s. We have data about this. These chronic deficits in our education system, plus the refusal for political leaders to recognize the real risk to children, have left many children behind. The pandemic put schools front and center as the public good that was left to solve so many of society's problems. We know kids need to go to schools, but they need to go to safe schools. Safe for every child, even children with immunocompromised conditions. But even now, they're not able to access because we have lifted the bare minimum of the protections that were in schools for the past couple of years. Schools could have opened safely, wave after wave, if we had effective, meaningful, and science-based protections. Instead, we heard that kids were not impacted. We heard that we had to get kids back to normal. And you know what, Jason Kenney? Kids have been kids this whole time. I don't know where you have been, but they have been kids caring for each other protecting their communities and their families by doing the things that need to get done. Despite the negligence of governments, we saw children caring for each other. Students rose up to care for their families, for their grandparents, for their siblings. They wore their masks, they got their vaccines when they were eligible. And teachers rose up to the occasion too. The students and teachers in schools were left to protect one another and their communities at large. So today we're also here to honor the bravery of children in this pandemic, who did their best and better understood what it meant to care for their classmates, their neighbors for 2 years and counting, more than adults. Just a few weeks ago, we were on these grounds when students led a demonstration on their own, on their accord, to keep protections in schools. We heard their voices straight from their mouths. They get it. They understand that public schools must be accessible for everyone. Let us be reminded that children under 5 still don't have vaccines available to them. They still exist in our society. The pandemic isn't over. We need to protect them. Children get it, so we will keep supporting them and protecting their right to access safe and equitable education, even as this province, fresh off the heels of lifting protections, is going full speed ahead privatizing. On Monday, the Premier is announcing new funding to private education commodities. This is disaster capitalism, and we will be watching and we will be fighting. Thank you for coming.
Thanks, Dr. Lee. We actually have 2 last-minute additions to our agenda. So if you'll bear with me, Erin, who is the activist who put together the rose display with her family, has also asked to speak for just a minute or so, if that's okay. So Erin, please join me in welcoming Erin Aylward.
I knew when we started this, beyond a shadow of a doubt, that there would be NDP MLAs here acknowledging these deaths, which is awesome, and I love them for it. But the problem is I also knew, beyond a shadow of doubt, that there would not be one single UCP MLA here. The same MLAs that went to the convoy would not show up here. The one message I would like to send to Kenney is, Kenney, just because you don't see it or refuse to see it does not mean it's not happening.
Well said, Erin, and thanks very much for your words, but especially for this wonderful, thought-provoking display. We also noticed that we were joined today by the Edmonton Raging Grannies, who are an institution in civil society here in the province, and we've prevailed upon them to sing one song for us.
Let's all stand close together. Okay. Well, we came as individuals without a definite plan, but we always have songs up our sleeve for every occasion. And because this began and continues to be a memorial where we acknowledge the losses of valued citizens to a terrible virus, which many of these deaths could be deemed unnecessary and almost criminal. So we grieve and mourn, and we have a song that we often sing on these occasions. It's called Spirit of the Wind. Let's gather in close together. Spirit of the wind, breathe in me. Spirit of the sun, rekindle my flame. Spirit of the rain, fill my dry and deep recesses. Spirit of the land, raise me again. Again? Yeah. Okay. Spirit of the wind, breathe in me. Spirit of the sun, rekindle my flame. Spirit of the rain, fill my dry and deep recesses. Spirit of the land, raise me again. Can we all tap into the spirit of the land and rise again for justice and for truth and for democracy, healthcare, and for all of those things to provide us with safe and sane healthcare policy. So this is our impromptu performance.
So that brings us to the end of our program for this afternoon. I want to thank the Raging Grannies for their song. I want to thank our speakers for their words. I want to thank Erin and her family for the beautiful and thought-provoking display. But most importantly, I want to thank all of you for being here today, but also for believing in the community. That the pendulum may have swung in terms of the discourse around COVID right now, but we know that by following the science, we know that our community will need our support, our care, and our advocacy more than ever going forward. Thank you for being here. Thank you for caring.